January is National Birth Defects Prevention Month, and while we can't prevent all types of birth defects, there are some steps that women who are trying to become pregnant, or even women who are just of childbearing age and may become pregnant, can take to mitigate some of those risks. The first thing we often talk about is taking folic acid, and you may have heard this before. It's incredibly important in preventing neural tube defects, or spina bifida, which is the other name. We recommend that women take at least 400 micrograms of folic acid every day if you're trying to become pregnant, for at least a month before you become pregnant, and then throughout your entire pregnancy. Folic acid does occur in some different types of foods like fortified cereals, but the majority of people don't get enough in their diet. So we recommend taking a supplement each day during that process of trying to become pregnant and then during your pregnancy. The second tip is around medications. So it's very important to be extremely clear and honest with your doctor about any medications that you take when you're trying to become pregnant and when you are pregnant. There are certain medications, very few, that can be harmful to fetuses, but there are maybe potentials that you could switch to a different type of medication within the same class or decrease the dose while you're pregnant, but don't do any of those things without talking with your doctor first. They can give you very clear recommendations about whether your medications are safe, and if not, how they might change them. The third tip is just around general health and wellness. So it's really important that our general health be in check at the time that we're trying to become pregnant and while we're carrying babies. Obesity is something that can really negatively impact pregnancy. It can increase your risk for gestational diabetes and other complications, both for mom and for baby. Being underweight also is not ideal when trying to grow a healthy baby. So if your weight is not in a normal range, if you're underweight or overweight, make sure that you talk with your doctor about ways that you may be able to get to that healthy weight before or during your pregnancy. The next tip is around vaccines. We often think of vaccines very clearly for baby once they're born, but there are things we can do to protect them even before that. So it's really important that pregnant women get boosters like pertussis and flu shots every year, but I encourage anyone who's going to be spending time around that infant in the first few months of life to make sure that they're completely up to date on vaccines. So that can include dads or non-pregnant partners of the pregnant woman. It can include grandparents or anyone who's going to be doing significant contact and caretaking with that child. We know that updating vaccines like whooping cough and influenza in moms who are pregnant will protect babies for the first few months of life until they're old enough to get their own vaccines. The last tip is around substance use during pregnancy. So everyone's pretty clear that alcohol and tobacco are not a good idea while you're pregnant or while you're breastfeeding your baby. But marijuana is a question that we are increasingly being asked in practice. So now that marijuana is recreationally legal in our state, it's really important that we're very clear with women who are trying to become pregnant and with their partners about the risk of smoking and of secondhand smoke and exposure to marijuana in those young infants or the fetus. If you're pregnant or breastfeeding, the clear recommendation is that you not use marijuana at all. The data is not great, but we do have some data showing that marijuana use during pregnancy or breastfeeding can impact things like increased risk of low birth weight, of admission to the neonatal ICU, and potentially even increased risk of long-term problems like school performance or ADHD. So the best thing is to avoid all illicit substances and marijuana while you're pregnant and while you're breastfeeding your baby. If you have any questions or you have substances that you're currently using, make sure that you're honest and clear with your doctor about that so you can have a conversation about how to lower the risk. For more information, you can go to Swedish's blog or to the Centers for Disease Control.